John Walsh, not John Walsh from America's Most Wanted, but the one from, I'm sorry, is Ireland or Great Britain?
Ireland.
There you go. See, I know.
Ireland.
Yeah. So, could you tell me about your ankle and how did it get to this, condition?
It was originally caused by a very bad sprain where I slipped off a curb.
All right. And did you do one of these like that?
Yes.
Okay. Inversion sprain.
Inversion.
And you rolled the ankle like
Right.
this, right? Yeah.
Right.
Uh-huh.
And from then,
How many years ago was that?
3 years ago,
Okay.
at a wedding in San Jose.
All right.
And originally it was very bad. We had some therapy on it and it's straightened out, but then it has progressively got worse over the year.
Okay. And then what treatments have you tried before coming to see us here?
Apart from the ordinary, I bought a typical brace I put on it.
Okay.
I put different types of, liniments on it.
Did you see any other doctors or foot specialists about this?
I went and seen in Desert Oasis my primary care doctor, who sent me after a 2-month wait.
Uh-huh.
To
A
a
2-month wait.
2-month
Wow.
wait to a doctor who told me that they only do knee and hip.
Ah!
So I
You
walked
waited
out.
2 months to say, we don't do ankles. We don't take your kind here. We don't
That's-
take ankle folk,
That's
right?
no exaggeration.
Yeah. Uh-huh.
So
And this wasn't even a general hospital, which is usually out of red tape. This is a private clinic, huh?
That's correct.
Wow. So what did you do after that?
I happened to see your advertisement.
Wow, okay.
In the
And you
LA
drove
Times.
all the way to our Newport Beach clinic or the Garden
Garden
Grove?
Grove.
Yeah.
We drove up there one day and we had original consultation with you, and from there it's gone to here. That we're so glad to see you down here.
Yeah. And so on a scale of 1 to 10, how bad does that ankle pain get when it gets at its worst?
Like right now, 0. But when I
Okay.
start walking, it can go to 7,
Okay.
8.
All right. Well, and it's hard to climb stairs, I'd imagine.
Not too bad.
Okay, but just walking on flat surfaces.
Yes.
I want to see how you're walking. Could you go ahead and slide down and tell me when the pain starts? And go ahead and walk down the hall. And let's get the wife out of the way. I thought it was your daughter, so yeah. So you have to kind of limp, huh?
Yes.
And once you come on back. And if you were to continue to walk like that, what is the pain on a scale of 1 to 10? When it gets
to
at-
7, 8.
Okay, go ahead and walk. Yes, you have to put your weight on your right leg, huh?
Yes.
And do you have any pressure on your right hip or back or knee because of that?
No.
Sometimes? Okay.
No.
Yeah, but that's something we want to avoid in the future.
Yeah.
All right. Okay, now I got a good idea what's going on. Let's start the treatment, okay? You want to film me right there so they know who's the mysterious man. All right, so get on the mat here, and I'm going to examine your ankle. And our camera lady could kind of examine what we're doing here. You know who John Walsh, the America's Most Wanted guy, was, right?
Yeah.
Yeah.
A lot of people say, "Are you the John Walsh?"
That's funny.
He lost his son.
Oh no! Oh, that's right.
Yeah, he was
That's
kidnapped.
what got him into that, huh?
Yeah.
He was on a crusade, kind of like Spider-Man, to rid the world of crime.
Yeah, they were shopping at the shopping mall and the kid disappeared.
Yeah. All right. I'm gonna get a head cushion for you right here. That's better for you.
That's
Okay.
better. Yes, sir.
Perfect. All right. So I'm gonna check his range of motion of his ankle. So this is called dorsiflexion compared to the normal foot. And I'm gonna take this off for a sec. And you can see how limited his flexion is here.
There's a
So he
fusion on
can't bend it as much as this side, okay? And then if I flex it this way, it's probably more painful. And then if I go this way, sometimes this is more painful too. You see you're guarding already. That's starting to get painful right here.
Yes.
Yeah, right there. So the most common sprain is an inversion sprain when you roll your ankle. And the most common ligament damage is your anterior talofibular ligament right here. So that ligament was probably torn, talus and head of the fibula, the base here. And that's why when I stretch this. This is the main pain point right here, right?
Right.
Yeah, because that's where the most scar tissue, when he tore his ligament, he got a bunch of scar tissue there. So when we try to stretch it out, it kind of like, it bites and, you know, it doesn't release. That's what causes the stiffness and pain and swelling. And the swelling is there because when he sprained his ankle, it was probably very swollen like a golf ball, I'd imagine.
Yes, big time.
And that dead blood and dead fluid has never drained. So that's what we're going to do today. And this is an infrared laser scanner. And it's going to detect inflammation in the ankle. So if our beautiful assistant Vanna White could come to the side, and you can see how swollen it is. Now this will detect where the worst inflammation is. And see, we got a temperature spike. You notice how it's, if I go here, it's like 89. If we go to that main injury site, it bumps up to 90.7. So we know that's where the worst inflammation is, right there where that talofibular ligament is, okay? And now what we're gonna do is, I have these are called myofascial release tools, if you want to take a look right here. And I invented these tools, and what these do is they gently break up the scar tissue. So I'm going to show you how it's done right here. And let me show you. This is the emolling that we use.
Do you want you in it or just
You can put parts of me in it, but
go this way?
yeah, And then what I'm going to do is I'm going to scan the areas of the scar tissue, and right there. You feel that bumping, grinding in there?
Yeah.
Feels like sandpaper, right?
Yeah.
That's the scar tissue that formed. It's your body's natural reaction to stabilize the ankle joint after injury, after inflammation. How the problem is, if that scar tissue is not properly rehabilitated, if it's not properly stretched and broken up to restore normal range of motion and circulation and nerve function, you're going to have chronic pain and swelling and stiffness. So it was not properly rehabilitated, and